Dr. Woody, it is so great to see you. Today we're talking about painful shyness or extreme shyness. Now, this is something that adults and children both have, and some people may think that it's just harmless, but it can actually lead to some issues. So I want to make sure that people understand that we're talking about more than just the typical shyness, though, right?
You're right, Melissa, and thank you for having me today. I think it's important that folks realize that we're all shy at times, but the kind of shyness we're talking about, painful shyness or awkward shyness, or if you were going to talk about it in psychological terms, you could call it diffidence. At this level, it's also referred to as social phobia. And that sort of thing really gets in the way of a person's ability to have fun, to enjoy social interactions, and actually to develop really good social skills. So yes, it's very different than just your everyday shyness.
And do we know what causes this type of shyness?
It seems very clear that painful shyness or social phobias are evident as early as 4 months of age in infant research. And those children that react adversely to mobiles over their cribs in research paradigms actually end up being those children who end up being very, very shy. So we know that there's a biological component to it, or a genetic component, but genetics and biology aren't destiny. So we also are aware that the environment that the child grows up in can clearly impact the situation, both in a negative way and a positive way. So there are lots of factors that play a role. Stressful environments for children in their development clearly set them up for lack of confidence and difficulty with self-esteem. And that can be a real beginning to someone who has problems with shyness.
And if a parent has a child or perhaps an adult knows another adult who seems to be dealing with this extreme level of shyness, give some advice. What can they do? How can they help?
Well, I think the first thing is important, especially for a parent, is to understand that children who have elevated levels of shyness or anxiety can be worked with. And it's important not to force the issue. Being a good listener, asking good questions, and enabling the child to talk about their feelings as they are developmentally able to sets a really good environment for parents and children to exchange their feelings. Now, if you're talking about an adult who you happen to have befriended, who seems so shy that they can't tolerate being in social situations, it's perfectly appropriate to express your thoughts and say, I'm wondering, are you feeling anxious? What is that about? You want to talk about it? Having the ability to reach out to somebody or to have someone reach out to you, if in fact you're the shy person, really is the beginning to the conversation about, okay, well, if you do want to do something about it, what might that be?
And if someone needs more help, can they get that from a counselor or a psychologist?
There are lots of things that can be done in a structured or more formal way, beyond a friendship or a parental relationship with a child. There are multiple therapies that are very clearly evidence-based and appropriate. Under certain circumstances, folks have a physiological level of arousal and anxiousness that actually prevents them from approaching dialogue about it. So sometimes medication, pharmacotherapy is very helpful in combination when you're going to go see a counselor or maybe a clinical psychologist.
And Dr. Woody, where can people go to learn more about this?
Well, there are a number of places. In fact, there's a Shyness Institute that talks about ways to manage shyness and how to address it. But here locally, you can go to optimidaho.com where we can provide some direction. The American Psychological Association also has a wonderful website that's dedicated to issues related to not just shyness, but social phobias as well.